Since it began in 2016, All-Can has emphasised that efficiency in cancer care means focusing resources on what truly matters to patients, whether that's time, for example time to diagnosis, quality of life or other better outcomes. And that's why we created the Efficiency Hub, a first-of-its-kind platform that collects and shares best practice examples from across the entire cancer pathway. We hope that these examples provide inspiration for action so that we see these successes replicated across different contexts to drive meaningful change. So let's have a closer look at one of these examples featured on our website to see how efficiency can truly transform patient outcomes.
The process for requesting financial assistance in helping people living with cancer to us as a Qatar Cancer Society to be able to help them with the out-of-pocket co-payment costs that they need patient to be able to pay it. It was a tedious submit papers, need to come to the office, frequent phone calls. Imagine, people living with cancer going through the stress of cancer itself, then add a layer of it, the financial toxicity. So that's why we thought of digitalizing this process and make it in a platform that make it all through the tip of their fingers, application, two-way communication that they can submit and receive back and forth communication and decision from a process that will take few days till we get the approval, and they can starting access to the drugs with a connection with the hospital to a platform that have all stakeholders involved, not only the patient, the people living with cancer and us as a Qatar Cancer Society, but also the treating hospitals, the government entity that they monitor all the cash flow for fundraising. First, it reduced their stress because they're receiving the answer, the approval, or the decision about the decision for accessing their treatment and access to their care quicker. They can submit all what they need. They submit all the document from their phone, from their website, from everywhere, anywhere. And in the same time, they have the comfort that they have two-way communication. So when they submit their paper through the application, they have the follow-up. They see how their application, their process is moving forward. They receive constant update. They don't live in this, what's happening with my paper in that office, sitting in the desk, or is it moving, people reviewing it or not. So they are seeing the status of their request and their application in an updated live dashboard. And also it's important for the treating hospitals. They know the status of the approval of the application, so they know, that they can order the medication, starting treatment, planning everything, the approval, and so on. And the platform of Wayyakum was not built from one-sided mentality. It was co-designed with the people living with cancer, because Wayyakum it's an Arabic word, meaning English with you. It's the platform that will be with the people who are living with cancer with their journey throughout. So the co-design of the process and the application with the people living with cancer was really useful, because without having that done with them, it could have been really, I would say 50% less effective than it is now. Invest in solutions that create two-way communication. So that's a very important lesson learned. So one of the biggest plan for improvement in the Wayyakum platform is we want to enforce more and build up more the psychosocial support services through the Wayyakum platform. So it's not going to be only for improving access to treatment in a timely manner, but also to help to provide more psychosocial services through the application and connecting that with artificial intelligence in a way that respects privacy and confidentiality.